right, good afternoon and welcome to Ask the Docs, a Fertility Institute of Hawaii live stream. This month, our topic is fertility preservation. Thank you for joining us today. We have a lot of great information to share with you. My name is Dr. Carmone. I'm here with Dr. Goulet. And so let's start out with just discussing, Dr. Goulet, what is fertility preservation?
Great question. So with fertility preservation, we are able to retrieve and cryopreserve eggs, embryos, and sperm for future use later on down the road when you are ready to use them. So this is something that we can offer for both ladies and gentlemen. And it's a great thing to think about if you are wondering if you might be delaying childbearing, or if you're worried that your fertility potential may not be as good in the future. So if you have certain health conditions such as an autoimmune disease, or if you know you're going to go through cancer treatment, for example, or if you have something like endometriosis, which is very common, freezing eggs at a younger age can help preserve your fertility as where it currently stands. That being said, you don't have to have a health condition. That you can do this selectively. You can say, hey, I'm 23. I want to take my fertility potential in my own hands. I want to store some eggs for possible use later on down the road. And it's something that can give you a bit of peace of mind that you have an extra opportunity later on to turn to if you're not able to biologically create a child on your own beforehand.
Yeah, so as Dr. Goulet mentioned, there's both egg freezing and sperm freezing. Men are lucky in a few different ways, but the main one regarding sperm is that they continue to produce sperm throughout their lives. There may be some decline in the function of the sperm, especially when men are in advanced ages, 50 plus. But for the most part, men are able to produce sperm that actually can make babies kind of well into their later years. That's not the case, unfortunately, for women, where the theory is that we're born with a certain number of eggs, and then, with time, those eggs go bad and they become atretic. So we lose eggs both in terms of the quantity as well as the quality. And as such, it's becoming more and more popular for women to freeze eggs in order to prevent those age-related issues should they choose to freeze those eggs. And those eggs stay the age that you were at the time that you froze them. And as far as we know, there's no expiration date. And so, you can theoretically keep these eggs forever and try and use them many years in the future. And hopefully kind of preserve whatever success rate you would have at the time that you freeze them.
For gentlemen, there are some situations where they may want to consider elective sperm cryopreservation. For example, if you're thinking of having a vasectomy, unfortunately, vasectomy reversals are a real thing, and sperm numbers don't always come back to baseline after a reversal. And so by freezing sperm ahead of time, you can have that little bit of reassurance. Also, if you are a gentleman thinking about going on long-term testosterone therapy for low T, then freezing your sperm ahead of time can also help guarantee that you've got sperm to use later on in the future, because after testosterone therapy, sperm may or may not come back to the baseline function that it was before the initiation of testosterone.
Yeah, and cancer treatments as well for men, because those treatments can kind of damage the stem cells, the testicular cells that produce the sperm. And so, if you're using chemotherapy for autoimmune diseases or cancer treatment, certain surgical conditions, then it does make sense for men to freeze sperm as well.
Right. And for both men and women who are considering or transgender transitioning prior to doing hormone therapy, we would recommend consideration of fertility preservation as well.
So we often get this question of when should I freeze my eggs? And that can be a tough question to answer. Oftentimes women will come in and they'd like to do some fertility testing, and they'd like to know, should I freeze my eggs now or should I wait? And that can be a difficult question to answer because we don't exactly know what will happen to ovarian reserve after one particular point in time. So if you're female, you come to my office and I test you and I look at your ovaries, I do some blood work, and I see that your ovarian reserve looks excellent right now. I really can't tell you what your ovarian reserve is going to look like in 2 years and 3 years and 4 years. It's probably not going to disappear by next month, but in a year, in 2 years, we're not really quite sure what that slope looks like. So typically the answer is that for egg freezing for women, if you're talking about success rates alone, the younger the better. On the other hand, the younger you freeze eggs, the less likely you're going to need to use them, because ultimately, if you freeze eggs when you're very young, you're probably not going to need them as you get older.
Yeah, life happens. You might find out that you have a surprise pregnancy in between. Right. So,
and there's different ways to look at this, and I don't think that there's really a right or wrong way to look at this. You can say, well, even if I never use my eggs, it's nice to have them in the freezer and have the opportunity to be able to use them in the future. Or you might say, well, this is an awfully expensive process for me to go through, if I'm not really going to be using them. And so in terms of the cost, because I mentioned expensive, of course, it does vary in terms of geographic location, as well as how much medication you might need to use depending on your ovarian reserve. I mean, I would say, on average, again, it really varies, but you're probably looking at around $10,000 for egg freezing. It varies depending on region, but it's going to be approximately that for egg freezing.
One question that I get is, what's involved in the process of egg freezing? How much time out of my schedule is this going to take? Do you have to take off of work? And it's something that we can typically complete within 1 month. You do typically have to go on some hormone pills, usually birth control pills, for a couple of weeks. You will then start injectable fertility medications, the same ones that we use during IVF. One way I talk about egg freezing is it's IV without the F. It's doing all of the medications, but we're not actually fertilizing the eggs that we get out. And so we'll be doing the same medications that we do during IVF, and you'll do those injections every night for about 10 or so days. And then the retrieval is done under anesthesia. So we do it here in our office. We bring in an anesthesiologist. You're asleep during the procedure, so you don't feel it. It's through the vagina, so you don't have any scars or any incisions. You do have to take off of work that day because of the anesthesia, but most people are able to go back to work the very next day, unless you have a very physically laborious job, in which case you might want to take 1 or 2 days off. That's also fairly common. Leading up to the retrieval, there are a handful of doctor's visits for transvaginal ultrasounds and lab work. So you can expect to come in every other day for 3 to 4 ultrasounds. And typically we do those first thing in the morning so that we can have labs back later on in that afternoon. And we hope that your employer will be understanding, but if they're not, we're also happy to make sure that we write you a work note and to help you with those accommodations, and so that you can be here to take care of what's important for your health.
So it's important to know kind of who is really a candidate for fertility preservation for women. And women have to be within their reproductive years. So if you are in menopause, egg freezing is not going to work, because we're not going to be able to mature whatever kind of eggs are there, which are no longer functional, and be able to use them in the future. Similarly, prepubertal girls are not able to undergo this process either. So it has to be women who have already undergone puberty. And then, keep in mind that This is kind of the 2-week process that Dr. Goulet was mentioning, which does require injections, which does require vaginal ultrasounds, and does require an invasive procedure. So people who really don't tolerate those types of things, this may not be the best option for them. In terms of the ovarian reserve, even if you're not menopausal, if your ovarian reserve is very poor, we can attempt to extract and freeze eggs, but the success rate is going to be relatively low, and the odds that process is going to result in a pregnancy in the future is low. And so, at times patients might not feel that it's worthwhile for them.
You bring up a great point. I always encourage my patients to set up an appointment to have a consult so that we can do an evaluation and do a workup to get an idea of what their ovarian reserve is, to set some appropriate expectations of how many eggs we will be able to freeze in the future. I also refer my patients to a website. You can Google this. You can just type in egg freezing calculator. The first thing that should come up is medcalc.com. And it's a little bit more helpful after the fact, after you know how many eggs we've been able to freeze down. But you can play with some numbers and get an idea. If you're 42 years old and we get out 4 eggs out, what are your chances of successfully having a singleton live birth? What's the percentage that we expect? Or if you're 25 years old and we get out 12 eggs to freeze, what's the likelihood of having a live birth? And that it would be significantly higher for that woman in her 20s and for the woman who's approaching her late 30s or early 40s.
Regardless of what the success rate is, the process is very, very safe. So the main risks for egg freezing are the same risks that patients are kind of undergoing with a regular IVF cycle. So for example, from the egg retrieval itself, infection or bleeding, pretty rare. We're just using a needle. And so these types of more serious complications are unlikely. Something called ovarian hyperstimulation syndrome, if you over-respond to the medication, you can get sick. And so that's why we monitor, to prevent that type of complication from happening. But the modern protocols that we utilize and the modern kind of trigger injections that we use towards the end of the cycle, severe ovarian hyperstimulation syndrome is pretty rare. And so overall, very minimal risk for any type of complication with this surgery. I think the major sort of complication that people might experience is that in the future they try and thaw these eggs and they don't work, or they're disappointed with those results. I think that's really the major factor to consider. One very common question, though, is am I still going to have eggs left after you do this? Is this going to affect my future fertility? If you remove 10 eggs, does that mean I have 10 eggs fewer? And interestingly, the answer is no. And that's because every month, if you're ovulating, okay, you typically will naturally ovulate 1 egg, but there's some number of eggs that die off, that become atretic. And that number, that background atresia number, is dependent on your ovarian reserve. And so if you're young and you have an excellent ovarian reserve, you're going to have a lot of eggs that are dying off every month. So you release 1 egg and let's say another 10 eggs die that particular month. Well, what we're doing with IVF or with egg freezing is we're actually rescuing those eggs that would have died anyway. Okay, so we cannot mature eggs yet. I mean, with the technology that we have available now, we really cannot mature eggs within your body that have not already started that maturation process. And once they've started that maturation process, they're going to die. They're going to be gone unless we get them out. So we are just rescuing eggs that would have never seen the light of day. We are not stealing eggs from future you, so it really does not impact your fertility. And it's pretty well documented and well studied that even undergoing multiple cycles like this, in, for example, young egg donors, et cetera, people who have undergone multiple IVF cycles, we don't see a negative impact on fertility at all.
Yeah, I think that's a very good point. Another question I get is with the hormone increases, is this going to increase the risk of cancer, especially for those who are considering fertility preservation in the setting of BRCA1 and 2 or other oncogenic known carriers? And we don't think it affects the rate of cancer. And so one way that I frame this is during a typical ovulation cycle, your estrogen levels might reach about 200 or 500 during a IVF or egg freezing stimulation, your estrogen levels might reach 2,000 or 5,000 for a week, right? At the peak of your stimulation. But during pregnancy, that estrogen level skyrockets. And so if you're comfortable with the idea of being pregnant one day and how high that estrogen level will be sustained for 9 months, in comparison, the small bump in the estrogen levels for that week is minor in comparison.
Yeah, so if pregnancy is safe hormone-wise, then the egg retrieval should be safe as well. In terms of patients with hormone-sensitive cancers, where we don't want the patient to become pregnant right now, and we prefer to keep their hormone levels low, there are actually are medications that we can utilize. Commonly, we use a medication called letrozole, which will actually keep the estrogen level low, even with ovarian stimulation. So as Dr. Goulet was saying, typically estrogen levels do become high during the stimulation, and that's okay for kind of that short period of time. But we just kind of are extra careful with patients who already have a diagnosis of cancer. And a lot of women are doing egg freezing because of that diagnosis of cancer, because they're going to be undergoing chemo and they'd like to preserve their fertility. And so we can, along with the typical injections, also utilize this medication to keep those estrogen levels down and lower their exposure to these hormones, and hopefully prevent any type of progression that may occur. So that's also a possibility as well. For the majority of patients who are doing elective egg freezing, we will usually, as Dr. Goulet mentioned, start a birth control pill, or there's sort of a little bit of a preparation process leading into things. It usually starts with a period. For patients who need to complete egg freezing prior to starting something like chemotherapy, then we can start an egg freezing cycle anytime in the cycle. It may not be 100% ideal, but it is better than nothing. And so if you or somebody that you know are facing a new cancer diagnosis where chemotherapy needs to start, in the next 2 weeks, you can come in for treatment. We can start you right away. And I think most centers that offer egg freezing for cancer patients would be able to do that.
Yes, very good. Common question that I get is, okay, so what happens years from now when I'm ready to use my eggs? I encourage most of my patients to try natural fertility first, so to try to conceive on their own, or to try to conceive using some of our other fertility treatments, whether that be oral fertility meds or inseminations or even IVF. I like to use these eggs that you've banked as sort of your extra opportunity, but only as other methods have failed. So we hope that you never need to come back and use them. We hope that you're able to achieve a pregnancy naturally, but if you do need to use them, what does have to happen is the other half of IVF. So at that point, we would thaw those eggs, we would inject them with sperm, and then check the next day to see how many successfully fertilized. They're then cultured in our lab, in our embryology lab, for the week to see how many are alive and thriving at the end of the week. And of those embryos that make it to the end of the week, we then have opportunities to do transfers with those embryos or freeze them down again, so that we can do a transfer now, and then a few years down the road, when you're ready to try for another sibling, we can thaw that embryo and try again.
Yeah, and so a lot of patients also ask, I mentioned this sort of before, whether they need to freeze eggs. Is this something that I have to do right now, or can I wait? And I mentioned that it's hard to really know exactly whether or not you're going to need these eggs, because even if your ovarian reserve is excellent now, it might not be excellent next year or in 2 years or whenever you're really planning on conceiving. But there is one other point there, and that fertility is a lot more than just eggs and the function of eggs. And so even if your ovarian reserve is amazing right now, you could still have infertility and not know it, because there could be a uterine factor, there could be a fallopian tube issue, there could be a male factor. Who knows if you're single right now and you're planning on having a male partner in the future, you don't know what his sperm function is going to be like. So there, you could have trouble because of him. And the biggest issue probably is that 20-25% of people have unexplained infertility, where everything looks perfect. The egg, the sperm, the uterus, the fallopian tubes, it all looks great, but you still can't get pregnant for whatever reason without help. And so even if your eggs are amazing, there's really no guarantee that you're going to be able to get pregnant naturally. And there's no guarantee that the eggs that you've harvested are 100% going to work for you. And so we are limited to the success rates per your own biology, your body, and of course the sort of age of the eggs that we've removed.
One thing I do want to bring up, though, is I think we're both seeing more and more insurance plans that are offering the benefit of fertility preservation, where still the majority of plans don't, but we are seeing more and more often those who have certain plans like Progeny, Carrot, Win Fertility are offering not just one cycle sometimes, but several attempts to freeze and preserve your eggs. And so if you're unsure if you might have a plan that allows you to do fertility preservation, please don't hesitate to reach out to your insurance company or schedule a consultation with us, because we're also happy to look and see if you have those benefits as well. And we're seeing more and more companies now also offer fertility preservation in the setting of a cancer diagnosis. And so if you are being faced with that hardship, we are also happy to help point you in the right directions. We're very experienced at knowing where there are grants available to help assist with fertility preservation in the setting of a concerning medical diagnosis such as cancer.
Yeah, so I definitely urge you to speak with your fertility doctor, the fertility office, in terms of financing plans, as well as there are certain organizations that can assist as well. So what happens if you try to freeze eggs and we don't get a lot of eggs from you, or your ovarian reserve is very poor and it may not quite make sense for you to freeze eggs at this time? What are the options for the future? Well, you could consider, of course, trying to get pregnant now, because, then we may be able to kind of go through multiple cycles and know what we have in the bank in order to help you achieve a pregnancy. And the other option is to use things like donor eggs or donor embryos in the future. So there are alternatives for people who may not be great candidates for egg freezing at this time, or who just feel that it's not really, financially feasible. There are a lot of insurance plans that will not cover egg freezing, but will cover fertility treatment. And so if you're in Hawaii, most of the insurance plans that are kind of commercially available here or through employers here will cover fertility treatments, but not necessarily preserving fertility. So that's kind of another thing to consider. If the reason that you're doing it is because you're single, then freezing eggs can be a great idea, but you can also certainly consider getting pregnant utilizing donor sperm. And you can use anonymous donor sperm. You can use a directed donor, which would be somebody that you know. And so I don't want people to think that you're kind of pigeonholed into one particular line or way of doing things.
I think those are all great points.
All right. Well, I feel like we covered everything. If you guys have further questions, you guys can always write in later, and we can try to answer that. Certainly, if you would like to consult with us, then please do go ahead and reach out. Thank you for joining us today. This is Ask the Docs, a Fertility Institute of Hawaii live stream. For more information, please check out our website, ivfcenterhawaii.com. And if you have, I already mentioned, if you have additional questions, please leave us a comment below. We hope you will join us again next time. Aloha.